I'm Dr. Ryan Stanton, and the doc is in. On Friday, March 13th, President Trump declared a national emergency with relation to COVID-19. This just means more efforts and finances are put towards the fight against this infection. The main steps now from us from a public standpoint are the social isolation or distancing. In the social distancing concept, that means we're trying to separate folks, meaning less exposure to potential infected patients. In this, we're trying to decrease that curve, trying to decrease that increase that we're seeing within the United States now and flatten that out and spread that out, meaning that we will save healthcare resources and decrease the impact on our first responders, emergency departments, hospitals, and our population. At this point, we're still seeing risk to some populations, especially in our elderly population, those with chronic lung conditions, hypertension, diabetes. For the most part, though, it's relatively low risk, but the risk is not zero by any stretch of the imagination. For the vast majority of us, the best thing to do is to stay at home when able, try to avoid large crowds, and the personal protective type practices, including frequent hand washing, 20 seconds with soap and water, hand sanitizers when those are available and you're not around soap and water, and of course, if you're at increased risk, working with your doctor on the things you need to do. Also, we want to make sure the message is clear. The emergency department is not a place to go for the testing, especially if you're asymptomatic. If you start to get symptoms, contact your healthcare professional or your state-associated organization to get guidance in terms of next steps. We want to protect emergency resources for those with critical conditions and also the other medical conditions that we will see during this time. We're having ongoing conversations, Q&A, on our Stanton MD Facebook page, as well as our Doc is In Facebook page and at Everyday Med on Twitter. I'm Dr. Ryan Stanton, and the doc is out.